Hello and welcome to another video. I haven't done one for an enormously long time, and you know what? Sometimes it's okay to take a break to focus on other things. So today we're going to be looking at the Health Equity Assessment Tool, which was upgraded back in August 2024. If you're not familiar with the tool, there are obviously on this channel links to other videos which explain what the tool is and how to use it. I go through section by section. In today's video, I'm basically gonna really focus on the value of why we have the Health Equity Assessment Tool, what's in it for you and for me, what might be in it for your organisation, and what's in it for the community that you serve. I'm not going to go into detail about the updates of the Health Equity Assessment Tool themselves. I'd encourage you to have a look at a link in the description of the video. It's hosted by OHID, and you'll be able to see the guidance. I suppose in summary, really, what's happened to the latest version is that they have updated a lot of the guidance. There are prompt questions, lots of prompt questions in there, to give you guidance about how to frame your answers. But my takeaway from it really is, like with anything in life, is that actually if you're going to be more confident about using something to inform how you're addressing inequalities in the role that you do, practice makes perfect. Not you're doing the tool on your own, you're supposed to do it collaboratively. It's an iterative tool, it's a live document. And yeah, the only real way you're going to develop your knowledge, skills, and confidence around using it is to use it and use it regularly. So, playing on that really, I probably want to look at three things here. Yeah, what's in it for me, which is partly touched on already. What's in it within your organisation? What's in it for your community? If we look at the what's in it for me, I've spoken already about it's an opportunity to improve your knowledge, skills, and confidence, especially if you work in a commissioning role. Population health traditionally focuses heavily on data and insight, and that includes insight about things that we find out about inequalities. Inequalities stem in many cases from things associated with the wider determinants of health and well-being. We've explored those in previous videos as well, and yeah, a lot of the data points to a lot of these issues starting out, being born out, and actually being compounded by things that happen outside of when somebody actually starts to access care. So the air you breathe, the amount of money you got in your back pocket, the family that you have support from, your environment, your community, how you behave around your health. A lot of those are things to do with what they call the wider determinants of health. And really putting yourself in that place where you're using the Health Equity Assessment Tool, or HEAT tool as it's called, really puts you in that place where you're thinking more strategically about how to address problems associated with those three paramount things of access, experience, and outcomes of care. The HEAT tool is great for you, as it gives you that method and rigor around how to frame problems with an inequalities lens, whatever the problem might be, especially if it's got something to do with healthcare. It could also be applied to other settings as well, such as social care as well. And yeah, it's really effective in that sense, especially effective in the context of commissioning, given all of the changes that are happening right now around the configuration of integrated care boards, the role of integrated care boards around commissioning, a greater focus on strategic commissioning, building on the work that's been done around developing the integrated care system. And yeah, I suppose the last bit around the what's in it for me is, I suppose, have a think about what those four core purposes of the integrated care system are, because they're not going to change. There are always going to be like those four core purposes. They might be renamed somehow, they might be rebranded, but actually those four core purposes are really the essence of what all of our strategic commissioning needs to be centered around. And the HEAT tool really is framed in a way that helps you start to think about how you're going to approach tackling those four core purposes within the inequalities lens. So that's the what's in it for me. There's a lot in there. I think a lot in it for you as a person and your development. What's in it for your organisation? Well, depending on who you work for, if you work for a provider or a commissioner, I think there's a number of things that I've got here that I think are really key. I think first of all, it gives your organisation an ability to be able to demonstrate due diligence around the public sector equality duty in ways that it might not do before. If we look at organisations who have public authority, look at the Equality and Human Rights Commission around what's expected in terms of showing due diligence, there are a number of different requirements. And in terms of routine business, and remembering that public sector equality duty applies to all functions a public authority has, then the use of the HEAT tool in an area of population health management is incredibly important, an incredibly important tool as a means to demonstrate how we are showing as an organisation, whichever organisation you work for, again, due diligence against the Equality Act and the general duties of that, such as fostering good relations, managing the risks around discrimination, and managing the risks around different protected characteristics, experiencing varying degrees of outcomes, access and experience, and what we're doing about that as an organisation. Secondly, it's very important for organisations to be really transparent about how they come to decisions about what it is they do, and how it takes respect to things associated with the Equality Act, the three duties, and how you're approaching a problem, how that goes about addressing any risks associated with access, experience, and outcomes of care. So the organisation that you work for can use HEAT as a means to prepare for that and show the method and rigour it's done for that. And it's a live tool as well. It's a learning tool. So we're not expected to know everything all at once right at the start. HEAT is used at the start, yes, but it's a learning tool. It's an iterative process. Certainly one that's not done by oneself. And yeah, the last bit around the organisation is it has been proven, when done well, is for certain HEATs, it's been shown that it gives an opportunity to make links between health inequalities and things around the prevention agenda in ways that you might not have been able to before. Because there are questions that the HEAT poses around the causes of inequality, where inequalities are lurking in the first place, especially around the wider determinants of health and well-being, and what is in your sphere of control as an organisation to start to influence that and tackle that. So the HEAT tool is very useful for your organisation in those respects. And lastly, what's in it for the system as a whole? When we talk about the system, we're thinking about the, I suppose it's called the integrated care system in health and social care settings, the health system. I like to think of it as a bit like an ecology. It's very organic. It has different layers to it. It has lots of different people, lots of different partners. It's incredibly diverse, but it's also incredibly complex. So what's in it for the system? If everyone who's involved in some capacity in designing solutions to problems our population faces about having really good levels of health, really optimal levels of well-being, living healthily, having a really good healthy life expectancy. If you're in that area of business, whether that be you providing care, you commissioning care, auditing care in some way, if you're involved in service redesign, if you're involved in developing policy, then if everyone in some respects is all using a similar method and rigour to frame inequalities in respect of the role that you do, then the use of the HEAT is a really good way of making sure we've got a good level of consistency across the system in how we do that. And also, not just consistency, but cohesion as well. Remember, if we think about cohesion in the context of the heat is not done alone. To be effective, it needs to be done in partnership. It needs to be co-produced. It needs to be done right at the start of when you're framing a problem, when you're planning something, or when you're designing a new service. And cohesion plays a really, really important role there, because the heat represents lots of different components and lots of different layers around how a problem could and should be tackled. And then the one last thing about system, what's in it for the system, is the whole thing about making connections, connections with people across the system who need to be involved, who have a vested interest in addressing the problem that you're looking at, working with different partners and stakeholders to work through together, to come up with a solution together, to agree on outcomes together, to be involved in approaching the problem from the outset. Be that whether you work for an organisation, whether you're a member of the public, whether you're an advocate for someone, whether you work in the public sector or a voluntary community sector, whichever it may be, for using the method and rigor around the health equity assessment tool, and we're committed to the principles of it, especially around connectivity, then there's a great deal amount of value use of the heat tool has for the system as well. And that's it. I mean, there's probably loads of other reasons as well as value to it. And actually, really, the real value will be when you discover for yourself. If you use it, if you experiment, if you don't be afraid to get things wrong, if you use the help that's out there, be hungry, have the appetite to learn more. And I think really it's all about really just testing things out, not being afraid to get things wrong, and being inquisitive and asking questions. That's really what the heat tool is all about. Hence, there are so many questions in the new guidance to prompt discovery. And that's it for today's video. That's all I wanted to do, really. I just wanted to focus really on what's in it for you, what's in it for your organisation, and what's in it for the system. I would be really interested to see what your thoughts are on that. Always interested to see how it's being applied. Interested to see if you're using the new template. What were the good things about it? And what have you learned from it? I suppose one last thing as well really is around policy. Like I'd love to know if your organisation has got a policy around use of the heat tool. If you have any plans to do training around it. What your thought from that, and it would be good just to see how it's being applied. It'd be great if you can share examples as well. That would be great. So that's it for today. I'm not sure what the next thing will be for the next video. It may go beyond something around the heat tool because we've done quite a lot on that already. I hope you found that helpful, and it would be great to hear from you if you've got any thoughts to share. Thanks a lot. Cheers. Take care. Bye bye.